Hello and welcome to the Growth Paramedic channel. This is the Pharmacology series and today we're going to be going over Midazolam. So let's write that down on here. Before we begin, as always, I'm just going to do a quick disclaimer. So this channel is for educational purposes only and it's not intended as medical advice. While I always strive for 100% accuracy, errors may occur and medications and protocols do change over time. So please do not solely rely on information provided on this channel, but as additional reinforcement to your learning either at paramedic school or on as road as a practicing clinician. So now that we got that out of the way, we're just going to go to the kind of framework that these classes are structured as, and it's going to be the same way that we've been doing it for the last, I think, 4 videos. So for Midazolam, we're going to have the definition. So what is Midazolam and what is it used for? So what class of Midazolam is it? What class of drug is it? As well as that, we're going to have the pharmacodynamics. And if you're not sure what pharmacodynamics are, they are what the drug does to the body. Then we'll follow up with precautions. And that's all going to be time-stamped. So if you're in a rush, you can quickly, If you're in a rush, you can quickly go to whatever section that you need to look at and not have to watch the whole video. This one shouldn't be as long as the rest. I think this probably only takes about 20 or 25 minutes. Time. What do I do here? Sorry. Time stamp. So stamped. If I can actually. Time stamped. I do not include the pharmacokinetics or any medication like dosages because again this is for everyone. Doesn't matter which ambulance service or what country you're watching this from. So if I was to give the dosages from where my ambulance service is, it's going to be probably different to the one that you're accustomed to. So that's just going to be removed just to reduce any complexities that can come from that. Okay, so this is going to be the introduction. We're now going to move on to the definition of Midazolam. So we're going to go down. I'm going to write definition. So Midazolam is a benzodiazepine. I'm going to put that underneath. It's a short-acting central nervous system so CNS depressant. And what I'm actually going to do is I'm going to write this way. Now I realized when I was writing cursive it was quite messy, so to make it look nice to the eyes I'm not going to be writing cursive anymore. I'm going to be writing kind of very simple in a very simple method. So the Midazolam is a benzodiazepine. It's short-acting central nervous system depressant, and we'll go through what a depressant is later on, but because of this is the effect it has. So it induces amnesia, I think there's 3 more we'll add to here. So induces amnesia, anesthesia. So Midazolam is used in the operating system or the operating procedures and surgeries in hospitals. Hypnosis and sedation. So from there you can already tell that Midazolam is primarily used as kind of a sedative drug. And what's unique about this class of drug? So let me go down here. So what's really unique about benzodiazepines in comparison to other medications that we use is that, and this is the key part that you should be aware of, it has a very rapid onset of effects. So it's very fast. And as well as that, whilst it's been very quick in terms of acting, it also has a very short duration. Short duration of action. And this is why it's primarily or mainly used for patients experiencing seizures. So usage. So it's used for two things in the pre-hospital setting. This is important to note. Okay, we'll do that. So seizures and sedation. Because it's a CNS depressant, it lowers inhibition of the CNS, and that results in sedative kind of tranquilizing effect, similar to the other drug that we mentioned, droperidol. So droperidol and midazolam can be used to sedate patients, but generally it's used to treat seizures, whether it's generalized or focal. So for seizures, it can be generalized or focal. And we'll cover seizures in the middle class series. So if you're wondering how seizures work and what they do and the various types of seizures, that will be covered in a later video. Okay, perfect. So we'll continue on with the definition. So further on, the diazepines are also known as and this is kind of more of a slang term, benzos. They are, more specifically, a psychoactive drug class. And again, I need to reiterate, this is really important. They are, and let's make that blue if we can, depressants. And when we talk about depressants, it means meaning they act to slow, keyword, slow down activity of the central nervous system, so the CNS. This includes messengers traveling between the brain and between the brain and body. So think of midazolam as the opposite of adrenaline. You know how adrenaline is an agonist, and when it binds to the alpha 1s and the beta 1s and beta 2s, it causes a biological reaction, and that increases activity in the central nervous system. So it causes, constriction of the blood vessels, increased heart rate, and whatnot. With midazolam, you almost think of it as the opposite to that. It actually inhibits further activity. So you can almost say it's an antagonist, but it's not really defined as an antagonist, but it really does have kind of the opposite effect to what adrenaline, for example, would have. So it's all about depressing the system, and it's about calming, in a sense, patients down. And we'll go further with that in the next section, which we're actually going into now, which is the pharmacodynamics. So let's head down to that. If you need to take the notes, or if you think I'm writing a bit too fast, you can pause the videos down. However, if you think I'm going a bit too slow, you can speed the videos up, which is a pretty cool feature of YouTube. So pharmacodynamics. And as always, I like to always write what that means. So what the drug does to the body. And it's not like pharmacokinetics, because that's how it's absorbed in the body. And we're not going to go through that because I think the main thing is knowing how it works in the body. We can talk about pharmacokinetics, but then it just goes way too much into detail, and you're looking at all the chemical and blood-brain barriers and all that kind of stuff, and it just gets a bit messy. And as paramedics, your main goal is to know exactly when you administer this drug, what is it going to do to the patient. So that's kind of why I'm mainly going to be talking about the pharmacodynamics. So with the pharmacodynamics, let's see. So with the pharmacodynamics, the sedating effects of midazolam that we mentioned before. Midazolam are achieved by, and this is important, midazolam, quote, enhancing, super important guys, it enhances the action of the inhibitory, well, that's a bit too spaced out, inhibitory neuro spelling transmitters. And this is called, so this inhibitory neurotransmitter, this is known as the gamma aminobutyric acid. And really, I don't ever call this the gamma aminobutyric acid because that's just way too long. This is, and I'm going to refer it from this, it's also known as GABA. So really, as long as you know that midazolam is enhancing the action of GABA, and GABA is an inhibitory transmitter. So let's continue on. Let's continue on from this one. So by enhancing GABA, so the activation, I can't spell these days. Let me just change that. The activation of GABA receptors allows for increased permeability for chloride ions, resulting, now this is going to be a bit of a wordy paragraph unfortunately, resulting in cellular hyperpolarization, let's go, increasing the resting membrane threshold. Potential gradient. And because of this, this causes subsequent decreased neurodischarge, and that is known as depolarization. So by increasing the resting membrane threshold potential gradient, I'm not going to go through what that is, but just by increasing that, it leads to decreased neural discharge. And that is depolarization. Perfect. So what you need to get, from this is that GABA, so main point or points, GABA is one of the major inhibitory neurotransmitters in the CNS. So inhibitory means, again, it's literally in the word, to inhibit, to slow down, to almost block the pathway. So inhibitory, so GABA is trying to inhibit or trying to slow down the neurotransmitter pathways. And so because of this, and we know that midazolam enhances GABA by increasing the activity, of GABA, inhibitory actions of GABA are then raised. So it's almost like midazolam, you can think about it, is cheering on GABA and giving GABA the extra boost it needs to do its job even better than before. Raised. Perfect. And because of this raise, it leads to, I think there's three things. Sedative or sedation. Actually, I might even change the color here. Make it a little bit prettier for you guys. Let's go. So, sedation effects. Relaxes skeletal muscles. So hence reduces muscle usage in seizures and induces sleep. It's kind of sedation / amnesia as well, which is why it's used a lot in operating theaters, and that's why you go to sleep and you wake up and you're like, wait, what happened? What was that? You don't even remember the operation happening. So when used for seizures, we know seizures. So for example, one of the usages is seizures. So when used in seizures, we know seizures are results of abnormal, disorganized, and unregulated neurodischarge. So that's what seizures are by definition. By increasing the resting membrane threshold potential gradient that the GABA receptors do when you give them midazolam. So by giving midazolam, that leads to increase, so it's just arrow up, increase in the resting membrane threshold potential gradient. And then from there, that leads to a decrease in neural discharge. So by increasing the resting cell membrane threshold potential gradient, it reduces the neural discharge, and because of that decrease in the neural discharge, that then leads to reduction / stoppage or stopping of seizure activity. So that's kind of how midazolam pharmacodynamics works. It just enhances the GABA receptors, and GABA receptors are inhibitory neurotransmitters, and when they are enhanced or when they are increased because of midazolam, that has a sedative effect. When it comes to precautions, we're up to the last part now, so we moved on. If you have any questions about what I've just said or anything else that you want to clarify, just comment on the videos and I will make an effort to reply to you as soon as I can. So with the precautions, I think there's only about 2 that I really want to point out. Please be mindful to reduce the dosages please be mindful to reduce the dosages when used in the following groups, and they all have their different reasons for it, but generally you should be mindful if you're going to use it for elderly patients because of their older age. They usually have chronic conditions and they usually have increased sensitivity, leading to more adverse effects. Patients with chronic renal failure. I'm not going to explain exactly all the reasons why. You can research them yourself, but these are the ones that you should be aware of if you're going to be using it for. So cardiac failure or shock. With midazolam as well, midazolam can cause respiratory depression because again, it is sedating a patient. So midazolam, depression, or respiratory. I'm going to put it here. So one group in particular you should be mindful of is that there can be severe respiratory depression in patients with chronic obstructive pulmonary disease, with COPD. And we will cover that medical condition in the medical series. So COPD can cause exaggerated respiratory depressive effects, and if you're going to administer midazolam, that can worsen those effects already there. So COPD can cause exaggerated respiratory depressant effects, and administering midazolam can worsen it. So just be mindful of that when you're treating a COPD patient, that you might want to use a lower dose, or just make sure that you're monitoring them for any signs of adverse effects, because if they do go into respiratory depression, you would have to ventilate for them, and that can again be a bad situation that you probably don't want to put yourself in if you can avoid it. Hopefully you enjoyed. Hopefully you learned something from this class. Midazolam is quite an important drug to have within the ambulance and as a paramedic or EMT, because again it is mainly used for seizures or sedating patients. So I hope you guys learned something, enjoyed it. If you want to see more, make sure to hit that subscribe button, as I do try to upload regularly these type of classes, and I will be starting a few other projects and series such as paramedic skills, medical class series as well. So yeah, stay tuned and I will see you next time. Cheers.